Hi, this is Rhonda Freed, and today I'm going to be explaining to you the results of how to understand your genetic testing results. When you get your genetic testing results, usually it's in the course of an appointment, and we're usually very time limited appointment and explained very quickly. And it sounds like a foreign language because it's letters. And it is a foreign language because this is new information you've never been exposed to before. And so it is all new. And so you won't be able to grasp it the first time you're hearing it. So it's a little bit of a slower explanation today so that you can review it with the results that you have in hand. And then also have information to look up more information and understand more about your genetic results going forward. Now, I want you to understand that when we order the genetic test, the reason that insurance companies pay for your genetic testing and the prime reason it's done is for depression and anxiety because there are a number of CYP genes that break down the antidepressants. Those are the genes that are used to break down and use the antidepressants. And if you have abnormal CYP genes, then the antidepressants won't work properly on you, or you'll have more side effects to them, or you'll maybe not even have a response to them at all. So the genetic testing is covered by the insurance companies primarily for those two reasons, for depression and anxiety medicines, which are all the antidepressant medications. So even though that's the primary reason for the insurance companies to cover the genetic testing, I actually, as a practitioner, and many of my colleagues believe that there's actually a lot other information that you get from the genetic testing for psychiatric disorders that is much more informative and interesting than the information you get about the antidepressants. There's a couple of reasons, and I'll try and explain some of those. One reason is that one of the best medications on the market today is a medication called Trintellix, and I'm not paid by any drug company. I don't serve on any boards of any drug company. But the reason that that particular antidepressant is different from all the other antidepressants is that that antidepressant has a mechanism of action that keeps the brain from reabsorbing serotonin once it's produced. And that is a very unique mechanism to that drug. But at the same time, Trintellix as a drug uses 5 CYP genes. So when it comes to using Trintellix, it also has a very high side effect profile. So even though we might have, looking at the genetic results, 5 is a lot of CYP genes to use for an antidepressant, we still use a lot of Trintellix in practice, even though you might have abnormal CYP genes that Trintellix might utilize. We still may go ahead and prescribe it otherwise. And that's part of the reason that the CYP application, even though it's the whole reason we do the genetics testing, is not the whole reason that how we apply the genetics testing in real life. Even though, according to insurance companies, this is the reason why we do the testing. So it's a lot more complicated and a lot more interesting and a lot more informative than just what the reasoning is that we order it. There's a lot more information here, and I want to explain some of it to you. But I am going to start out by explaining what the gene testing tells us. So I'm going to be using the Tempest testing results because that's the primary genetic testing I'm currently using. Most of these same testing results you will also find in your Genocide testing or Admira or other companies that you may have gotten genetic testing done. So pull out your genetic testing so you can kind of follow along as I go through the different ones. Now the different gene testing all have different numbers of CYP genes that are shown in the results. There are as many as 9 that I've seen in different testing. The Tempest testing shows 7 results. I think Genocide shows 6 or 7, and Mira might show the 9, and then there are other companies out there as well, of course. So ideally what you'd be looking for, if we were applying the testing results, we'd be looking for normal metabolism. So it would be saying normal or something that would indicate normal. Anything other than normal might still be okay. For example, intermediate metabolizer is still, or even wild metabolizer is still considered a normal result. You will still get a normal response to a medication. You may not get the most perfect or the most ideal response to the medication, but you'll still get a response. Then when you look at all your application of the data, you will see that there's more pages often that will list all the different medications and show you which CYP genes are used to break down that particular antidepressant. And then you'll see whether it recommends this antidepressant has a normal application, or this antidepressant, they recommend a smaller dose or a larger dose based on your CYP gene results that you've gotten. So that's how the CYP genes are used. When something says poor metabolism or ultra rapid metabolism, that's when you need to alter the dosing of the antidepressant for the individual. Ultimately, we usually want to avoid antidepressants that have those abnormal results of poor or ultra rapid metabolizer in those people, because they're going to be the ones that are going to have very bad side effects or pretty poor response. And that's the advantage of taking those tests, because you want to avoid the antidepressants that people are not going to respond the best to. So usually after 1 or 2 bad responses or side effect problems, insurance companies will go ahead and approve that we can do genetic testing. So the first part of genetic test results will be the CYP genes. And your practitioner should make a note of which ones are abnormal and try and choose the antidepressant where you're going to have the most normal ones. One of the reasons I particularly use Prestique a lot in my practice is that it only uses one CYP gene to break it down, and you have both serotonin and norepinephrine reuptake inhibitors working on that medication. So you get a lot of bang for your buck with that medication with only one CYP gene, which typically is not one that tends to be abnormal. So that's why it's a go-to that I use a lot. After the CYP genes, the next thing you're going to be seeing is HLA. HLA refers to risks of a genetic allergy that can be very serious with anticonvulsant medications. So we do use anticonvulsant medications a lot in psychiatry. We use them to increase the effectiveness of antidepressants. We use them off-label for anxiety all the time. We use them for migraine prevention. We use them for mood stabilization. We use them a lot. So we'd like to know who's going to be at high risk for something called Stevens-Johnson syndrome, which is a potentially life-threatening allergic response to an anticonvulsant. We're always very careful when we administer and order anticonvulsants. We go very slowly on the dosing because we're not looking at the same life-threatening condition as a seizure disorder as neurologists would be using. So we're able to dose them more slowly when we do introduce them. But it's always nice to know that people are negative an HLA normal risk of that Stevens-Johnson syndrome. The next thing you'll be looking at in your genetic responses is a HTR. And if it's at increased risk, we're looking mostly at either an increased risk of serotonin syndrome, if a person's on multiple antidepressants, also sometimes an increased risk in a change in EKG results from, again, antidepressants. Antidepressants sometimes can cause slight changes in some of the elongations and some of the speed of some of the spikes in an EKG. And some of those elongations in an EKG, when there's different speeds of the spikes during the heartbeats that can cause or be more, can predispose you to blood clots. So it can be a risk for some people for blood clots. So we want to know if people are at increased risk. And it's worse with Celexa if you do have an HTR to a higher risk. The next thing we look at on the gene test is SLC A4. That refers to the length of your serotonin transporters. So ideally, you would have LL as your type of serotonin transporters. Ideally, you would have all long serotonin transporters, because not only does the brain have to make the serotonin, but it has to get from point A to point B, where it needs to be in the brain, circulating freely to help you feel better from depression or anxiety. So if you have short serotonin transporters, there could be a problem from serotonin getting where it needs to be for you to feel better. It is the circulating serotonin that helps you feel better from depression and anxiety. It doesn't have to it's not just it being there, it has to be in excessive amounts that are floating freely in your brain that actually cause you to feel happier and more relaxed and feel better. So it's not just producing it that the antidepressants have to do. It actually has to reach these places in the brain where you need to feel better. So having long ones is important. We get genes both from our parents, both of our parents. So you have two sets, one from your mother, one from your father. So it's not unusual to have SL, half short, half long. Better than having SS, all short. The next genes that will come up in your testing results are your UGTs. The first UGT, the 1A4, refers to usually stimulant medication, and if you're going to process those correctly. And the second group of UGT results will be 2B15, and those usually refer to anesthetics and pain medications. So you can look up or bring this with you if you go to a pain specialist, and if you have abnormal results, especially poor metabolizer or ultra rapid metabolizer, you will want to bring that to your pain doctor. Or if you're having surgery, you'll want to bring those results with you to an anesthesiologist and say, because they will ask you if you ever had problems with anesthesia before, and you'll want to say, well, yes or no, based on your history, but you also want to say, I do have these genetic results. Is this something that's important? Does this tell you something that you would like to know that could be helpful in terms of my medication? As far as UGT1A4, that it can affect your stimulant medication, you'll want to show that to your psychiatric provider if you're on stimulant medication, because it very much might affect your stimulants that get prescribed. Very few people, however, really have issues with the metabolism of stimulants. Stimulants, often people don't feel them working over time. You get used to how they feel. They're still working clinically, even when you don't feel them working, but it's very common for people to think that they don't feel them working anymore. That must mean that they're not working anymore, but a lot of times it's just anxiety interfering and you feel like you can't focus or something else that's going on. The medications actually are still working. Then some of the other things I want to kind of go over, because to me they're extremely important. I'm going to go kind of out of order in terms of where they're listed on Tempus here. I want to talk about MTHFR, because to me that is the most important test in the genetic testing results, in my opinion, because I need to know if you need a medication like Deplin or not. Deplin is considered to be a medical food that right now is not covered by insurance. As you can kind of see with COVID being in the headlines these days, because it was a medical emergency, it went through FDA really fast. But in general, anything that is new on the market or new in medicine, it has to get a consensus of all the medical professionals before anything gets approved. And generally, it takes a very long time for that to happen. So these things are considered emerging evidence, emerging science, and there isn't a consensus right now. So unfortunately, as a result, this is considered medical food. All vitamins are not covered by health insurance. So this very important medical food is not covered by insurance and costs $60 a month. Why this medical food, Deplin is the one I prescribe usually, is so important to your health is that the antidepressants, if you're deficient in MTHFR, it means that you have genes in your gut that don't absorb this B vitamin that is needed in order to synthesize serotonin in your brain. So without the gut absorbing this fuel that's needed to make serotonin, your antidepressant will never really work properly or ideally. Your brain will be trying really hard with the antidepressant to make serotonin, but you're really only going to get an okay response to the antidepressant. You're never going to get a good response. And on top of that, the MTHFR is also very important for your entire immune system and a lot of body organs, your thyroid, your fertility system, all of your body organs, your liver. So many things are important to staying healthy that will suffer, and you'll have a lot more illness in your lifetime because you're deficient in this incredibly important vitamin. And here we have a situation that this has been discovered, so important to your health, and yet it's not covered by insurance, and yet it's really essential for your health. If there's any way you could scrape that $60 a month together to get that, I really recommend it, because yes, there are generics on the market, but what's different about Deplin is that it's been proven to bypass the gut and be absorbed directly into the brain, because that's the special mechanism of action. That's what you're paying that $60 for. That this company these chemists have developed a product that does not have to be absorbed through the gut. That's the miracle of the product. These other generics that they've come up with, yes, it looks on paper like it's the same thing. No, there's no testing that shows it does the same thing. And so you're paying $25 or $35 a month for something, and you have no idea if it's doing anything at all. And so if you can possibly scrape the money together, Deplin is what you should be taking. The second type of MTHFR that's on your sheet, which is the RS1801133, is very important to your heart and the valves and arteries of your heart. So if you also have C results in that gene, boy, you really need to be taking Deplin. You really don't want to be messing up with your heart health too, on top of your immune system health, on top of your brain health. So you're talking about a lot of things that Deplin's going to be helping with. I mean, I wouldn't mess around. If there's any way you can afford it, yes, I wish I had stock in the company. Yes, I wish I invented it. But if you can, find a way to take Deplin if you can. The other really important gene result that I want to go over briefly is the COMT. COMT is also considered to be emerging science. To me, there's nothing very emerging to it because it is so important. COMT is pretty much the gene that predicts ADHD and bipolar disorder. And probably predicts schizophrenia as well. It's not, again, those things are still up in controversy. Those things are not 100% in agreement, but is the COMT incredibly important? Absolutely. So when you see double mutations such as MET, VAL-MET, VAL-VAL, those are pretty important and should be paid a lot of attention to. In this situation, what I want to kind of refer to is this COMT is so important that you really need to be looking up much more about it than I will possibly be able to go into here. But what I want to just introduce about COMT is that it's thought that COMT is the regulation system that regulates all of your neurotransmitters. so that if you have mutations in COMT, the type that you have is important. It does kind of predict that you might have a mood disorder. It's going to predict ADHD with volatility, or predisposition maybe towards schizophrenia. And it tells you that because it regulates all your neurotransmitters, it suggests that you should not be a person who introduces a lot of toxins in your system. You will not clear them easily. So you want to avoid chemicals. Chemicals come into our body from food, from our clothing, from the utensils we eat with, from the bottles we drink from. You want to make sure everything is BPA free. You want to avoid alcohol. You want to avoid illicit drugs where you don't know where they're from. Like if you're a marijuana person, then you want to be going to a dispensary so you know what drugs are in there, that it is an organic drug. And because if it's from the street, you don't know what pesticides might be used. You don't know. You do not want chemicals in your body, period. Because COMT with mutation means you don't clear chemicals easily from your body. They accumulate over time and you will become ill easier than other people. It also means you don't recover as easily as other people when you get upset, because all these toxins are in your system and they don't clear. So when you get a hangover, you don't get over as easily as other people. Better idea, don't start drinking to begin with, because you're not going to handle it like other people do. So there's a lot to know about COMT. We'll be learning more about that more and more in the future. And for more about COMT, this is really the book I recommend. There's probably more than you'll ever be willing to do in terms of changing your lifestyle, but you might find one thing that you might be able to change in your lifestyle, and change happens when you adopt one thing that you can change, and maybe when that commitment gets easy to do, you can take on one more thing to change. So hopefully you got a little bit more information about your gene testing, and it was a little bit slower so you could remember a little bit more and take a little bit more in, and I hope that's been helpful. Thanks for spending some time with me today.